Paramedics are constantly dealing with conflicting views of health and well-being, and part of these views is the possibility of a patient refusing transport, even when paramedics are concerned about potential health issues becoming critical. It is important to outline the ethical and legislative policies surrounding valid refusal and end-of-life care in the pre-hospital setting to ensure paramedics are providing safe and appropriate practice. This video essay will use the pre-care framework to determine the most appropriate outcome that paramedics should make for Mr. Benson. Mr. Benson is potentially having an AMI. The paramedics, after their assessment, believe he should seek urgent medical attention, but refuses. The daughter who called the ambulance instructs the paramedics to also transport Mr. Benson. Facts is essential to providing the best care. Mr. Benson's only long-term condition is hypertension. It seems that Mr. Benson has had a stable angina that has progressed to unstable angina. Even though he has been recommended to see medical attention for his symptoms, he did not want to see a practitioner and is currently refusing to go to hospital. Mr. Benson refuses to follow medical advice to go to hospital, unable to understand that being otherwise healthy, the presentation is acute. As well as this, his wife's recent death could have affected his perception of hospitals, death, and possibly caused emotional grief and depression. Mr. Benson has had a close relationship with his daughter, qualifying her as his health attorney, and is trying to act in his best interests. On top of this, the patient is willing to take part in medical discourse and non-invasive medical interventions, as well as displaying understanding of presentation, considering the 1 hour and 20-minute conversation. Ethics are defined as the principles of ethics that all health professionals conform to and is the main ethical model that is used to justify ethical decisions. Autonomy, the right to self-governance, is the principle that identifies that a patient with adequate capacity or legal competence has a right to choose their option of medical treatment. Respecting Mr. Benson's decision to stay at home and receive no life-sustaining treatment is the most appropriate decision in consideration of autonomy. Beneficence is the principle that identifies that a health professional should only act or omit an act for the health and well-being of the patient. This is often considered acting in the best interest of the patient. Fully informing Mr. Benson of risks and benefits and providing basic non-invasive interventions that will relieve pain is the best way to provide beneficent care. With his current choice of refusing transport. Making the patient comfortable is a goal in the palliative care and should be a goal of the paramedic providing beneficent care. Non-maleficence is the principle that identifies that a health professional should act to cause the least amount of harm possible while being the most beneficial for the patient. This principle can also be interpreted as do no harm, implying health professional interventions are unlikely to make the patient worse off. From the information gathered, it is clear that taking Mr. Benson to hospital will only make him emotionally upset and angry, which can be considered as harm. Making sure the patient does not become distressed and supporting feelings that may arise in the end of life is the best way to avoid harm. The final principle is the principle of justice, which is split into distributive, legal, and rights-based. Respecting Mr. Benson's right to autonomy, assessment, and provision of his information allows him to make an informed decision about his healthcare. Protecting his rights-based justice. Respecting Mr. Benson's refusal and leaving allows the paramedics to attend another patient, protecting the society's distributive justice. The legal justice is also protected, but will be discussed in further detail below.
The Code of Conduct for the QAS states that any advice given must be objective, independent, apolitical, and impartial. Thus, when Mr. Benson states that he does not wish to accept treatment or transport to the hospital, the advice given must be non-coercive and respect must be shown for his requests. The Code also states that health professionals must comply with legislation and policies. The specific policy QAS has for validating a refusal of treatment or transport is VRCA. Mr. Benson was recommended to accept treatment and transportation, but was not coerced into a decision by the paramedics. His wishes were respected. The paramedics explained Mr. Benson's possible diagnoses and consequences that may follow, such as the possibility of having an acute myocardial infarction and sudden cardiac arrest. Mr. Benson refused transport regarding his current condition and possible life-sustaining intervention if he loses capacity. Mr. Benson has been deemed to hold capacity as he is conscious, educated, and able to discourse. He cannot be deemed non-capable due to mental illness as he shows no significant signs and has no previous mental illness diagnosed by a psychiatrist. The paramedics recommend Mr. Benson to see his GP instead of being transported and treated by them. An essential consideration in the pre-care framework is to identify an alternative option that is both reasonable to execute and potentially better suited. The main issue is that Mr. Benson could go into sudden cardiac arrest, and therefore, having a health professional present is vital to document and witness the deterioration. Involvement of home doctor service or possible allied health instead of the QAS could be a better option. This ensures that the cardiac arrest is witnessed and the end-of-life intervention and support is provided. In the case of Mr. Benson, neither his Advanced Health Directive or his health attorney have authority in his decision-making. This is reinforced by legislation, and he was ultimately still legally capable of making decisions. A health attorney, in this case Mr. Benson's daughter Jenny, is able to consent or refuse healthcare for her father only in the case of impaired capacity. The paramedics attending Mr. Benson's case identified that he held capacity, therefore was able to make decisions independent of his health attorney. If it is found that he does not, Jenny's decision for the paramedics to take him to the hospital would be granted. As Mr. Benson has provided the paramedics with this Advanced Health Directive, Jenny may no longer make decisions regarding specifics of his health care or life-sustaining treatment. The moment he loses capacity while in the care of the paramedics, his health directive takes precedent and must be followed above all else. Paramedics may partake in assault if they do not respect his Advanced Health Directive. Although as stated in the Queensland Health Implementation Guideline regarding healthcare decisions, an Advanced Healthcare Directive does not take effect unless the patient loses capacity, which Mr. Benson has not. The common law in Australia states that any person with capacity has the right to refuse any medical treatment proposed to them. If the health professional believes that the patient might be suffering from a mental illness such as depression, which might affect their decision-making regarding health, a psychiatrist must be consulted. In Mr. Benson's case, he has proved his legal capacity regardless of possible symptoms of grief and depression. Therefore, he is able to express his wishes to withhold life-sustaining medical treatment. By law, paramedics must respect these wishes as Mr. Benson acts as his own health advocate. In conclusion, after applying the pre-care model for Mr. Benson's situation, it is evident that the paramedics were justified to leave Mr. Benson at home. The paramedics were able to provide safe care by conforming to the bioethical model. They were able to validate his decision to refuse transport by using the QAS CPG assessment of VERCA, and were able to outline Mr. Benson as having legal capacity and therefore having decision-making capability for his own health issues and holding the right to refuse transport and life-sustaining treatment. An alternative option was also formulated to provide more holistic health care in the out-of-hospital